The Simple Truth, rising up to explore the difficult topics of real life. Join us as we proclaim the good, the true, and the beautiful with the simple truth of Jesus Christ and His Holy Catholic Church through Scripture, tradition, and the Catechism. And now, your host, Jim Havens.
It is great to be back with you on The Simple Truth, where we proclaim the life-giving reality of Jesus and His Catholic Church. We consecrate everything to the Sacred Heart of Jesus through the Immaculate Heart of Mary and the pure, strong heart of St. Joseph. It is Catholic Family Men Monday, where we primarily direct the content to men, most especially to those of us who are called to the vocation of marriage and family in order to build up husbands and fathers in Christ, to bless the family and sanctify the world. But make no mistake, everyone is certainly most welcome to listen in and or watch. Plenty here that is valuable and applicable to all, especially today. A most important topic for us to get some clarification on today. Our guest is Dr. Damon Cudihy. He's a Catholic husband and father of 8, as well as an OBGYN physician and much more. You can learn more about him and his good work by going to the website acadianaobgyn.com. That's ACADIANA OBGYN.com. Dr. Damon Cudihy, it's a great blessing to have you back with us again today. How are you?
I'm doing very well. Thanks be to God. It's good to be back. Thank you for having me.
Excellent. Absolutely. When we saw you last, it was during a Testimony Tuesday show, and a great episode sharing with us much of your personal story, and also weaving in some good truths in terms of the preborn science and medicine. But we need to dedicate a whole show to that, and so I want to begin where we left off, which was really with the services that you offer. So can you give a little summary of those services for us? What are the needs that you serve for folks who might want to reach out to you at acadianaobgyn.com?
Okay. Yeah, the way I'd like to describe it is the full spectrum of women's healthcare needs, especially those needs that are unique to women's reproductive health, from early time, sometimes even adolescence, soon after puberty, and problems there, throughout the rest of her life, even into the menopausal years. But really focusing on those times early and her reproductive years when she might be having difficulties with infertility or with cycle issues and problems in that area. But that includes caring for women throughout her pregnancies. And so even high-risk pregnancies are something that I take care of, and any issues regarding things that would be under the purview of what's considered a general GYN physician. I don't engage in the treatment of advanced cancers. That's another specialty of GYN oncology, but things short of that, I would normally be taking care of.
Mm-hmm. Outstanding. So really serving women in their reproductive needs, but in a very good way, in a very good, true, and beautiful way, not in the way that sadly so many OBGYNs of the world offer many services that are immoral, evil, and we're going to get into a lot of that today. That's why I was trying to figure out, what do we call this topic? I landed on preborn science and medicine because so much of it seems to get down into that as sort of the source of so many errors and evils that need to be corrected. So we're very blessed to have Dr. Damon Cudihy with us to instruct us in many ways, clarify a lot for us here today. And let's begin here with the scientific truth of the matter of human life, that it begins at conception, fertilization. This is a scientific truth. We can go to embryology textbooks and pull this out. There's nothing about a religious belief here. This is just simply science. Life begins at conception, fertilization. What can you speak to in terms of proclaiming that truth to us? And if you could also get into sort of this false medical definition that has taken root, especially here in the U.S. I'm not sure what's going on in other countries, but here in the U.S., this definition of pregnancy beginning at implantation, which scientifically would be incorrect. Pregnancy begins when human life begins at conception, fertilization, but not so in the medical textbooks in the United States here. So what can you share with us on this topic?
Yeah, it's great questions. That is a perfect place to start, the beginning of life. What better place to start? And I've given talks to pro-life audiences, like at a pregnancy center convention, where I made the point that was, I think, somewhat surprising and a little bit startling to some of the audience, and that the church actually doesn't teach as a matter of dogma that life begins at conception. That's not really something she needs to teach, or it's not even her purview in terms of scientific matters. The church merely teaches that it is always and everywhere wrong to intentionally kill an innocent human being. So those three criteria, intentionality, innocence, and human being, that's where we apply that to what science has shown clearly where human being exists. So to state that life begins at conception, i.e. fertilization, and I'll come back to the importance of combining those two terms, but is not a matter of religious dogma. It's not a religious teaching. We don't believe that because we're Catholic. We believe that because we're logical people. We're rational people with intelligence that accept the natural science as, is quite evident, and in which there really is a consensus. And so when did we have this consensus within the scientific community, the secular scientific community, you could say? And it actually goes back to right around the end of the 19th century, around 1876. There was a Professor Oster Hertwig who first discovered the role of inheritance and the role of the sperm cell, the egg cell, in conception. And this was around the time when microscope technology was first developed, where we could see under a microscope these sorts of cells. So I think that's important to understand, going back to the 1870s, because it was 100 years later when the Supreme Court and the infamous dishonest Roe versus Wade decision, one of the premises they based their decision on was this lie that they asserted when they stated they did not know when life began. And as I just demonstrated, it was clear that a unique human life began at the moment of fertilization, also known as conception. That had been clear for nearly 100 years. So then this is a lot of what I expect we're going to talk about today is going to come back to that. But that's something that we need to establish as a common ground, and move away from feeling that we need to justify this from what the Bible says or what Pope John Paul II or any pope said. This is something that should not be in dispute when human life begins and what is happening at that moment.
Mm-hmm. Yes, and talk to us about that distinction that you mentioned, that we need to make clear conception, fertilization, rather than allow people to kind of spin the definition of conception.
Sure. So fertilization, and etymologically, the word, we think of it in terms of plants and fertilizer and that. So it's probably not even the best word to describe that event where a sperm and egg unite to form a new human being. So the word conception is probably a better word, and its use in the English language actually appears to have early on described the beginning of the Blessed Mother's life, interestingly enough, even before it was applied to that scientific understanding of what conception is and when it occurs. So once we had this understanding of fertilization, that moment of a union of that egg and the sperm and the complete complement of chromosomes, their contribution, one half from the mother, one half from the father, that was for nearly 100 years, or at least 100 years, the consensus that these were the same event, conception and fertilization. But it happened in the 1960s, late 1960s and the 70s, during this political movement and attempted social engineering, where the definition, where there is advanced this redefining of conception to be an event later. They wanted to begin defining conception as being the moment of implantation, when the human embryo, somewhere between 7 and 9 days after actual conception or fertilization, would implant into the lining of the mother's uterus. So there is and this is an important time frame from the moment of conception, which happens typically in the fallopian tube. About 7 to 9 days transpire when the human embryo is growing and developing, and before it actually sets up into what's called becoming attached or implanted into the uterine lining. So there is nothing actually distinct about the nature of this unique individual being a unique individual from the moment of fertilization, conception to implantation later. But the reasoning, had, some ulterior motives to try to introduce abortifacient methods in this 7 to 9 day window that could be marketed and promoted as contraceptives rather than abortifacients, simply by changing the definitions in a very intentional manner.
Mm-hmm. Yeah, so important to be able to make this connection that, look, it's conception, fertilization. We need to make that clear because, the medical establishment, sadly, is spinning definitions like we see so much in the sort of progressive, liberal ideologies of today. They want to play with language so they can do what they want to do. And so in this case, to say that life begins at conception, they could use the same exact language and mean something completely different than we who would say the science shows that life begins at conception. They might agree with that and say, oh yeah, okay, sure. But we're saying fertilization, they're saying implantation. So they are disregarding, devaluing the human life and disregarding the human life from fertilization to implantation. Why? Just because, just as Dr. Cudihy just mentioned, it's so they can then justify abortifacients, birth control pills and devices, and call them birth control in terms of contraception, preventing conception from taking place. However, conception has already taken place in one of the ways that all of these pills and devices use, and it is snuffing out that early life between fertilization and implantation. And they can say, oh no, there's no abortifacient aspect here. There's no abortion here. Why? Because they don't even define human life beginning until their definition of conception, which is implantation. So important for us to understand this and so much more. Dr. Damon Cudihy is going to clarify a lot more for us when we get back. Stay tuned.
Prayer of deliverance. Almighty God and Father, we beg Thee through the intercession and help of the archangels Saint Michael, Raphael, and Gabriel for the deliverance of our brothers and sisters who are enslaved by the evil one, from anxiety, sadness, and obsessions.
We implore Thee, deliver us, O Lord.
From hatred, fornication, and envy.
We implore Thee, deliver us, O Lord.
From thoughts of jealousy, rage, and death.
We implore Thee, deliver us, O Lord.
From every thought of suicide and abortion.
We implore Thee, deliver us, O Lord.
From every form of sinful sexuality.
We implore Thee, deliver us, O Lord.
From every division in our family and every harmful friendship.
We implore Thee, deliver us, O Lord.
From every sort of spell, malefice, witchcraft, and every form of the occult.
We implore Thee, deliver us, O Lord.
Thou who said, peace I leave with you, my peace I give unto you, grant that through the intercession of the Virgin Mary, we may be liberated from every demonic influence and enjoy Thy peace always. In the name of Christ our Lord. Amen.
As a nonprofit lay organization financially independent from your diocese, our apostolate is listener-supported. The Station of the Cross thanks our supporters who have enabled us to broadcast Catholic programs for more than 20 years. Through your generosity, we are able to inspire countless listeners with the gospel message and help lead them to a parish to be spiritually nourished by the sacraments. Thank you for your continued support, and may God bless you and your family.
Do you love listening to the Station of the Cross on your car radio, but sometimes find yourself driving outside the listening area? Never miss another minute of your favorite show. Download the iCatholic Radio app so you can listen anywhere in the world 24 hours a day. The iCatholic Radio app is available for your phone in the Apple Store or for your Android phone in Google Play. Visit thestationofthecross.com for more information.
Simple Truth. Jim Havens here with our guest today, Dr. Damon Cudihy. He's an OBGYN physician and much more. You can learn more about him and his good work by going to the website acadianaobgyn.com. All right, talking in that last segment about how we are being lied to and deceived in so many ways by the medical establishment, who is participating in the evil abortion in many, many ways. And so Dr. Damon Cudihy is one of the good guys. He is not going along with all of this. In fact, he's standing up against it, offering great services and doing good work, as well as proclaiming the truth in this area. You can also get a hold of him and try to bring him in to maybe give a talk at your parish and things like that. His voice needs to be heard. This is very important, and that's why we have him on with us today. Dr. Cudihy, in talking about this scientific truth that human life begins at conception, fertilization, as we were in the first segment, I want to also ask, is this deception about conception beginning at implantation that the medical establishment has foisted upon the American people, and so many have no idea what's even going on? Is this also not only being used to justify the evil of abortifacients like birth control pills and devices, but also evils like in vitro fertilization? Does this also kind of find itself in this category of deception?
100%. I could not agree more with that, assertion. And unfortunately, that is exactly the situation we have here. Once you have created this false separation of conception not being the same event as fertilization, and this sort of idea that is not scientifically based, but ideologically and social engineering based, this idea that human life doesn't begin until implantation. There's no scientific basis to suggest that being created with the full chromosomal complement of every human being at fertilization is somehow a different thing, ontologically speaking, at conception. But what it does allow is it opens up this Pandora's box of interventions that we can pretend aren't destructive to human life. And IVF is one of the most pernicious and insidious ones, because as we'll can talk on that a little bit more later, but that really exploits the good desire to have children by sort of brushing under the rug or obscuring and hiding the reality that the majority of children created in the IVF process are actually do perish or do die, many times intentionally, before implantation. And so if we can convince ourselves that these aren't human beings until implantation, then there's somehow a way to assuage and sort of harden the conscience against the reality there. But before we even get to the IVF thing, a lot of what is sold and marketed as contraceptives are, in fact, many times abortifacients. And so we can take a step back. The only methods that are purely contraceptive would be latex barrier methods like condoms, or sterilization methods like a tubal sterilization or a vasectomy. So those are the only things that are going to be purely contraceptive. I may be missing one or two that it would be similarly trying to completely obstruct the union of that sperm and egg. But the majority of what people think are contraceptives, especially all the hormonal methods, I'm speaking of the birth control pill, the patches, the vaginal rings, the shots, the injectables, these rods that are put under women's arms, and the IUDs, these foreign devices put into a woman's uterus, all of these have varying degrees of abortifacient effects, and to varying degrees will prevent birth by preventing implantation. So in one sense, I don't have a problem calling them birth control if you are willing to, make the case understanding that, birth control many times is causing the death of the child before implantation in the womb. And by that definition, you could even say every surgically induced abortion is a type of birth control, because you aren't birthing a live child. But I think I'm very careful to make this distinction about what is contraception, what is purely contraceptive, and what is sort of a mixed effect between a contraceptive and many times abortifacient.
Mm-hmm. Yeah, great points. The language does matter. That's how they're they're getting their deceptions across so well by manipulating language. So yeah, being aware of how we're using language is incredibly important, and even just reflecting on how I asked the question and saying birth control. Normally, I say so-called birth control. In this case, I slipped it as I was talking because it's just very easy to just call it birth control, and that's the world we're living in. It's just so rampant. But really, yeah, so-called birth control. If we really drill down on the nature of what it is we're talking about, yeah, we're talking about preborn killing pills and devices. But yes, in a certain sense, yes, birth control in the sense that, yeah, it's killing human life before birth, as you mentioned there. So, but that's normally not what people are thinking about when they hear the term birth control. So yeah, great important points there. As long as we're on the topic of language, I want to bring up this topic with you. I don't know what you think of this, but this is something that bothers me in terms of manipulation of language. I think this is a manipulation that ought to be cleared up. It's rampant in the medical field, and that is this phrase spontaneous abortion when referring to miscarriage. I remember when my wife and we first experienced a miscarriage, and hearing this term, I'd never heard of it before, spontaneous abortion. It's like, this has nothing to do with abortion. This is a natural death that has occurred in the womb of my wife. The word abortion should be nowhere near it. And yet in the medical establishment, it's just commonplace. It's called a spontaneous abortion. And so I think that's wrong. I think there is a confusion of language, a manipulation of language that's taking place there, precisely because then when people say, I'm for personhood, I'm against all abortion, they can say, oh, see, they want to hurt women who are having miscarriages. And they use then the medical terms to say, see, those are spontaneous abortions too. Or God creates all these abortions, these spontaneous abortions. No, these are natural deaths occurring in the womb called miscarriage. I think we need to have a clear distinction in our language between miscarriage and abortion. That's why I hate this term, spontaneous abortion. What are your thoughts, Dr. Cudihy?
Yeah, well, that's a great topic, and this will be very valuable, and especially in the post-Roe discussion. I think the pro-abortion side has exploited the misunderstanding of language and use of medical terms and a proper understanding of them. So we'll start with the word abortion, as it's used outside of the medical profession, among the laity, so to speak, as regards outside of the medical profession. It's the term abortion, that what's usually implied, it would be more proper to say induced abortion, elective abortion, procured abortion. These are all terms to imply that this is not something happening spontaneously. This is something that the doctor is causing. And you could even be more specific, which might be helpful too when we're talking about that. We're talking about direct abortion. So a direct effect, and this gets into medical ethics, that the physician or not a physician, someone is doing something to directly cause the death of this preborn child. And so that is again, there's at least three terms: elective abortion, induced abortion, or procured abortion. Now, the word spontaneous abortion, I don't know if I would entirely agree that word is wrong that terminology is wrong to use within the medical profession, but it's not typically the way we speak to patients. When a patient of mine comes to me and I've sadly diagnosed a miscarriage, I don't look to her and say, you've had a spontaneous abortion. I say, unfortunately, your child has passed, the baby's not living anymore, you've had a miscarriage. So the more unique term I would use to describe that is a miscarriage, not spontaneous abortion. Another analogy I would describe it as, when someone has a heart attack, the doctor doesn't say to them, you've had a myocardial infarction. That's the medical term. You would say, you've had a heart attack. That's why you need. So I think there often is a distinction between terminology that's used in the medical record that's more medical speak, you could say, versus what is used in more colloquial common understanding. And so that's part of the distinction there, is that when we use the word abortion by itself is non-specific in the medical parlance. And so we have the two big things are spontaneous abortions, which would be the equivalent of a miscarriage. There are also things called a missed abortion, it sounds really weird. You see this horrible word because of all its negative connotations justly attributed of abortion. But the term missed abortion is what happens when we diagnose a woman who's had a miscarriage, but the remains of the baby are still inside her body. It means she hasn't had any bleeding yet. And so that's a term called a missed abortion. So some of your listeners may have had this diagnosis before, not sure what that means. There's another one called a threatened abortion. Any woman who has bleeding in the first trimester, we use the term threatened abortion. It doesn't mean that she threatened to go to the local Planned Parenthood clinic if she didn't get her way. It means, and so it can be very confusing. This is just language that I think is somewhat neutral in its intention. I don't think there's intentionality of being manipulative within the medical use of these terms. And then you can go on. There's an incomplete abortion where maybe she's had some bleeding and some of the fetal remains have passed, but there's some placental tissue still there. Septic abortion, which is more commonly associated with surgical induced abortions by an abortionist. That's where a woman gets infected. This was, in many ways dishonestly, argued to be a reason that needed to legalize it, because supposedly all these women who were having septic abortions were getting terrible infections from abortions because they were illegal. And there's that's a whole other talk that's not really true. The primary reason that few women have, serious infections from, even spontaneous abortions or even surgical abortions induced is because of antibiotics and just better medical care, even when they do have complications from those procedures that, are, abhorrent. So does that help, Jim, to understand that kind of, we're kind of crossing the line of what is more technical medical terminology versus common parlance and lexicon.
Right. Yeah, I can see that. Yeah, that was a wealth of information for sure. Yeah, Dr. Damon Cudihy is with us at CadianaOBGYN.com. So yeah, I get all that, but I guess this is where I land on it is to say, look, we have to define what abortion is in the way that it's being used. We have an ongoing daily mass murder of the preborn that is being called abortion. So to me, it seems we've got to define abortion as exactly as you said, which is the direct intentional killing of the human child in the womb. And so it just seems like if we're going to call all these other things abortion that aren't that, and just, have different descriptors on them, it sort of waters down our ability to just clearly define abortion as evil, abortion as the direct killing of innocent life in the womb. I don't know. Do you see where I'm coming from there?
Yeah, I do. And I think you'll appreciate, I have on the back of my car right now a bumper sticker that I had custom made. It says simply, abortion is murder. So I use that terminology because abortion in isolation in a public setting is implying precisely what you're saying. When you're speaking in the context of this person had an abortion, this abortion has been legalized or has been made illegal. We are speaking of, as you said, the direct intentional killing of an innocent human child. So that is true. And so we have to be careful that we are defining our terms in this language. So we're speaking of, again, abortion in isolation, abortion by itself. I think it's implied that we are speaking of what the medical terminology would specify as a procured, elective, or induced abortion. Mm-hmm. So I think, that's how we would bring those two together.
Mm-hmm. Got it.
Those 2
awesome.
points.
Dr. Damon Cudihy is with us. He's going to be back as soon as we're done with this break with much more. We've got some great stuff to get to, some great questions that are very important to get some clarity on. Stay tuned.
Here at the Station of the Cross, we proudly bring the truths of the Catholic faith to countless listeners through radio and mobile devices, and we're grateful for the feedback we've received.
I'm a widower, parent of 3 almost adults, and listen to you guys around the clock. Father McTigg, Society of Jesus, he's wonderful. Mother Miriam, of course, the Divine Office, and many other great things that Station of the Cross does. So thanks very much for your great work.
I had a friend at work email me and tell me about the Station of the Cross a couple months after it started. And I was so excited. I tuned into it, and I found that I love the Catholic Station.
If you've been blessed by listening to the Station of the Cross, let us know. Call 1-877-888-6279, extension 112. Then share your testimonial with us.
Husbands, have you ever worried about the risks to your wife's health from the birth control method she's using? Why not learn a natural method of family planning that is 99% effective in postponing pregnancy and causes no risks to your wife's health? Find all the information you need for natural family planning classes or the home study course from the Couple to Couple League website at www.ccli.org or call 513-471-2000.
Jesus 911, now weekdays at 2 p.m. Eastern.
My name is Jesse Romero. I'm a retired Los Angeles cop. I'm a Catholic lay evangelist. My show on spiritual warfare is called Jesus 911, where you got 3 retired LA cops, Ruben Nava, Eddie Chavez, talking about the Catholic faith and teaching you spiritual warfare, how to defend yourself against the devil, the world, and the flesh.
Catch the Soul Patrol, Jesus 911, 2 p.m. Eastern, 11 a.m. Pacific, on the Station of the Cross and the iCatholic Radio mobile app.
Back to the Simple Truth. Jim Havens here with our guest today, Dr. Damon Cudihy, a Catholic husband and father of 8, as well as an OBGYN physician and much more. AcadianaOBGYN.com is where to find him and more about his good work. There is so much to get to today with you, Dr. Cudihy, and so I want to make sure we can get back into what we've already been talking about. There's so much more there to unpack, but there are some technical questions I think that are important to get to, that I'm sure people are wondering about, that would love some clarity on. So before we get too far into the show, I want to just raise them now to make sure we get to it. So here's the first one. This is a question I heard recently. A woman who had this experience regarding her miscarriage. She was being informed that the child who had died in the womb, or she's being told the child in her womb has died by her doctor, and then being told, well, let's schedule you then for a DNC, which is ordinarily being used as an abortion procedure. Now, she was concerned about this, right? She's wondering, is it 100% that this child is no longer alive in my womb? And is it not better for me to allow, a natural sort of miscarriage to occur? What can you give in regard to just some guidance on women who are in similar situations?
Very good question. It's something I deal with frequently. All of us do in this profession that take care of pregnant women. So, and this is where the medical establishment would give recommendations that I would mostly agree with, and as we're taught, and even whether they're pro-abortion in other areas, their guidance on this is not something that I would disagree with. And they say that when you have this situation where a woman has been diagnosed with a miscarriage, i.e. a spontaneous abortion, for medical terminology purposes only, I would argue, there's really 3 levels of approach. And the first would be what we call expectant management, where we can wait. And many times, especially really early miscarriages, the woman will pass the remains of the child spontaneously or without any intervention. But then, so that is one reasonable option. And a lot of patients of mine prefer to do that. They don't want to deal with taking medications or being in the hospital for a surgical procedure. Now, if this doesn't work and 2 or 3 weeks go by and it's becoming very distressful for her, not knowing when she's going to start having heavy bleeding, it's not unreasonable to then start intervening to expedite the process. Now, once we start getting into this realm of intervening, whether it being giving a medication to cause the uterus to start contracting to expel the remains, or a surgical procedure, the DNC that you mentioned, then we need to be extremely certain we are talking about a true fetal demise or miscarriage. And so in my practice, and I can't say with certainty, and I do have doubts that many physicians are as careful as I'm about this, but I try to be absolutely certain. I want to be 100% certain, where there's no doubt in my mind that a miscarriage has occurred, because I believe that many times, I have certainty that many times miscarriages are misdiagnosed simply because there's a mistake in the timing. She may have had a delayed ovulation, so conception, i.e. fertilization, may have actually happened 2 weeks later than she thought, and there's different reasons that can happen. So in these situations, we may the physician may do an ultrasound, and she's only measuring 5 weeks along or 3 weeks after conception, and they don't see a heartbeat yet. But if they are expecting the woman to be 7 or 8 weeks along, they don't see a heartbeat, they may mistakenly assume that there's been a demise. So what do we do to have that certainty? It typically requires some hormonal testing, checking the pregnancy hormone level over a couple of days. And many times it might require waiting a week or two and doing another ultrasound. Has there been any change? And many times what we don't see, we can't even see the baby yet, even, the microscopic size, but 2 weeks later we do. We don't see the heartbeat initially, 2 weeks later we do. Sometimes 2 weeks later we don't, and there may be a situation where we do 3 or 4 ultrasounds because there could be that much uncertainty about the timing of conception. So that, I hope helps understand or clarify that. And I think most reasonable physicians, if a woman asks, can we wait? Can we do another hormone test? Can we wait and check an ultrasound again next week or the week after to make sure? I want to be 100% sure before we intervene. Now, as things go further along, if she is 8 or 9 weeks, and we can clearly see a baby that is the size of an 8 or 9 week from last menstrual period, technically 6 or 7 week size a baby from conception, and that's a subtlety. But anyway, there's a size at which we should be able to see the heartbeat, and if we don't, then we can't have that certainty that the baby has died. At that point, a DNC wouldn't be unethical, immoral, or reckless in any way, and it could be a reasonable intervention, and sometimes the best intervention if she's at high risk for hemorrhage. And the further along she gets, by the time she's 10, 11 weeks, there does start to be a higher risk of having a hemorrhage to where she may end up coming to the emergency room in the middle of the night from heavy bleeding. So a DNC, even though it is technically the same procedure done by an abortionist to kill a living child, in this situation, we're simply removing the remains, the corpse of a dead child. So it's on the outside, it might look the same, and it might be technically similar and are identical in some degrees, but it's the difference between putting a dead body in the ground and a living body in the ground in terms of what is happening ethically.
Mm-hmm. Yeah, very helpful clarification here today with Dr. Damon Cudihy, Acadiana, OBGYN.com. Let's move to one more technical question here. This is in regard to a woman who I recently heard this story. So ectopic pregnancy, the child in the womb has implanted wrongly in the fallopian tube. And so ordinarily, what I would know is that you would have a surgery that would be done that would remove that section of the fallopian tube, and the child would die as a consequence, but that is indirectly, that's not the direct killing of that human life. Therefore, it isn't an abortion. And so that's an important understanding. But what this woman was saying is that her doctor was telling her, and this was in a Catholic hospital, was telling her that she should be taking this chemical abortion pill to deal with this ectopic pregnancy. She was confused, wasn't sure what to do. What would be your guidance?
Well, so I'm assuming she's talking about the medication called methotrexate. It is also a chemotherapy drug. It's typically an injection. And yes, there is a lot of controversy about this among Catholic doctors, well-intended, who disagree. And it comes down to the direct action. Now, if you have a living child with a heartbeat, in the fallopian tube, and you give methotrexate, and the intention is to stop that baby's heartbeat, then that should be clear that we're dealing with a direct abortion, and that is not something that I could good in conscience participate in. I would argue that that is something that we should not be doing. Now, as it turns out, many times in the ectopic pregnancy, the child has already died, and you have just this placental tissue growing, even though an early miscarriage has occurred. Those situations, methotrexate would not appear to be working as a direct abortion. Now, that said, I find that doing the partial self-injectomy, removing the fallopian tube, to be the best treatment, both ethically and medically. When you start getting methotrexate, there's a risk that the fallopian, it may not work, and then she could have a rupture, an internal hemorrhage in the fallopian tube, and the whole reason that we are trying to intervene to begin with. So my preferred treatment in these situations, if we're going to intervene, is actually to remove that fallopian tube, and that is a clear and a classic example of an indirect abortion, where we are removing a diseased organ that has the baby, baby, in this case, the fallopian tube, and the child dies as an unavoidable consequence of that surgery to save the life of the mother. Now, the other really serious problem and I have with methotrexate is this gets back into the other problem I alluded to of a misdiagnosis. It is very frequent, in my opinion, and I think many experts would agree, that women are misdiagnosed as having an ectopic pregnancy when in fact they merely have an ovarian cyst and an early pregnancy. I delivered a baby when I was in residency, when I was at a military program. The only reason that baby survived and the only reason this baby wasn't killed by methotrexate is the doctor who had ordered a methotrexate injection for what she misdiagnosed as an ectopic pregnancy. This was a patient who was a soldier in Iraq at the time and had at the hospital in Iraq. And so they had to transfer her to Germany, to the Landstuhl medical facility there. And that took about a week or so for all that process to occur. And by the time she got to Germany, they did another ultrasound. And lo and behold, there was a living baby in the womb and the uterus in the proper place. So, and the sad thing was, I'll never forget, the day I delivered this child, I looked back in the medical records and it was a colleague of mine, someone that was a couple of years ahead of me in residency. And I just thought, she would be interested to know that this patient she had actually delivered a live child after she had misdiagnosed ectopic pregnancy and had tried to give her methotrexate. Her response to me, shockingly and disturbingly, was that she did the right thing merely because she was following a protocol. She wasn't able to look past some protocol that she was following as a script or as a recipe and see that if her order had been carried out and they had the medication available, she would have caused the death of an innocent child. And so there's a lot that I learned there, and that there's a certain callousness and sort of a security we take by following protocol, not just following orders, but following some published guidelines on how we should handle certain situations.
Mm-hmm. Yeah, Lord have mercy. Dr. Damon Cudihy with us at acadianaobgyn.com. One more, women who are on the so-called birth control pill for a long time. Maybe they've come to their senses about what's really going on, this poison, this carcinogen in their bodies, and they're experiencing a lot of consequences. Any advice for them?
Well, I say it's like quitting cigarettes. I mean, cigarettes are also a carcinogen. They're also a group 1 carcinogen, like so-called hormonal contraceptives are, or birth control pills. And like cigarettes, if someone's going to quit smoking, they don't need to finish the pack that they have in their pocket. And I say that with birth control pills. They don't need to finish the pack that they're on. I advise them just to throw it in the trash can and be done with it. And they will have a withdrawal bleed whenever they stop it, just as they would when they reach the end of the active hormone part of these pills. And like anyone and all of us in the medical profession are trained to always encourage women or men, if there are patients, to quit smoking because we recognize that as a harm to their health. Well, that's my approach to the so-called birth control pills, that they are carcinogens and they're not doing anything to help her. And in fact, they're doing many things to harm her. And sadly, this is a little segue, it's a point I wanted to make, that many women are on the pill, not because they intend to avoid getting pregnant, whether married or not, and whether they're involved in a sexual relationship or not, but they have been told that they need to be on it for their health. They think that somehow their cycles are being regulated, or their ovaries are being prevented from making cysts, or this is the best treatment for pain they have, or the only treatment they have to prevent them from having excessive bleeding. And the truth is that all of that is incorrect. That none of those conditions are best treated with the pill, and many of them are actually made worse in terms of their underlying pathology. At best, the pill is only masking the symptoms and covering them up, while the underlying problem is progressing and getting worse. And at worst, they're making the underlying problem worse, while also adding other risks to her, like blood clots that could kill her, or breast cancer that could kill her, or cervical cancer, things like that are other known risks of the pill.
Mm-hmm. Yeah, Dr. Damon Cudihy with us. And as you hear it, I mean, it's just so tragic to hear about where we are. I mean, we've got a good OBGYN here telling us the truth, but how rare such people are, how rare it is, because what we really have is this normalization of abortion in the medical field. And this leads to all kinds of problems, all sorts of perversions and just anti-science sort of behavior that is taking place within the medical field. There's an ideology that is baked in at this point. I want to talk to Dr. Cudihy about this ideology that is baked in the medical field when we get back. For example, abortifacients, IVF, many other items, but how did we get here? How did we get here? I'm sure Dr. Cudihy has thought long and hard about that. We're going to hear his summary thoughts of how did we get here to this normalization of this evil of abortion in the medical field and all that has come from it. What is the hope to get us back on track and to get more and more great OBGYNs like Dr. Cudihy out there? We're going to talk about that when we get back. His website, acadianaobgyn.com. Stay tuned.
If the cares and anxieties of life are weighing you down, come to the St. Thomas More House of Prayer and allow the Lord to refresh your soul. The St. Thomas More House of Prayer is a Catholic retreat center devoted to praying and promoting the Liturgy of the Hours. You'll find a tranquil atmosphere that's ideal for deep prayer, whether as an individual or for a group retreat. We're located at 365 Hill City Road in Cranberry, Pennsylvania. Make your reservation today or learn more at liturgyofthehours.org. You can also call us at 814-676-1910. That's 814-676-1910. We would love to help you experience the Liturgy of the Hours and discover the prayer that will change your life.
The iCatholic Radio mobile app is 2 apps in 1. Your place to hear great Catholic programs and music. Here's what listeners are saying about the updated iCatholic Radio mobile app.
Through the iCatholic Radio app, I have listened to the sermons and teachings several times. The effect has been a deeper understanding of my faith and Catholic tradition. This app has truly been a blessing in my life and has increased my faith.
With the new app, you can choose to listen to our programs like Mother Miriam Live or The Catholic Current whenever you like. But you can also switch over to the best in contemporary music by Catholic artists. We even bring you hours of Gregorian chant every Sunday morning. If you do not currently have our app, download it to your iPhone through the Apple Store or to your Android phone by going to Google Play and searching iCatholic Radio. The updated iCatholic Radio mobile app, your one stop for great Catholic programs and music.
Back to the Simple Truth. Jim Havens here with our guest today, Dr. Damon Cudihy. You can find him at acadianaobgyn.com. He is an OBGYN physician and much more, a wealth of knowledge. We're blessed to have him here with us. And Dr. Cudihy, want to get you on this line of thought in our final segment here, and this is the medical establishment in the United States. If only it were truly all about the science, but we have this evil ideology of abortion, so-called contraception, other items all baked in now for many decades in this system. How do you view it in terms of how did we get here? What can we do to try to set things right?
Well, you're right. I have given a lot of thought to this, and a lot of my training has been, in a very hostile environment. I spent time surrounded where I was alone among, my peers and faculty and mentors who all believed and thought of contraception, for example, as a basic part of women's health care. And obviously we as Catholics reject that, falsity. We, acknowledge that a birth control pill or other types of things are not women's health care, but actually women's health harm, both spiritually and physically. Now, and so I was just immersed in this environment that thought of contraceptive as a basic good thing. And I was reflecting on, where does this really come from? The idea that a woman's fertility is a disease state, and that the default mode should be to do something to alter her body's function, primarily women, to prevent conception. And ultimately, it dawned on me that this ultimately comes down to a hatred of human life. It's ultimately evil. It comes, quite frankly, from the pits of hell. A hatred of humanity is what is at the root of the contraceptive ideology. And so when we are trying to argue against it, I think as Christians, we have to assert what we believe, that life is good, that God loves all mankind, every human being, that he died, and would have died all over again if it were only for the sake of one human soul, one human being's life. And so we don't get to abortion, without first being at this hatred of life and seeing all life as somehow an evil. And so if you believe that a human life is intrinsically evil and an ill to be avoided at all costs, then that starts to explain the contraception. Or you can work it the other way. The only thing, if you believe that fertility is a good, then that implies that what would result is an evil if fertility was allowed to proceed. And so, and Mother Teresa has said things such as, abortion is basically implying, the logical conclusion that abortion is more or less backup contraception. And I was taught in medical school, for example, along these ideas that contraception was the best preventative medicine that was ever been invented. And so if abortion is the best preventative medicine, then if the prevention doesn't work, then what's the cure? So if the preventing the life doesn't work, then we have to resort to the abortion, which is the cure. So there's a direct link between the contraceptive mentality and the abortion mentality. And I think in the pro-life work, we shouldn't shy away from taking on this contraceptive ideology as well. And so I think that if we need to recognize that Planned Parenthood, the biggest abortion lobby, and their first law was actually contraception. They started as the American Birth Control League. They later had their name changed to Planned Parenthood. And long before they were dedicated to promoting abortion and the killing of children, they were first dedicated to promoting contraception and sterilization. So the way I describe it is Planned Parenthood's first love was contraception. And then out of their focus on contraception, that's where they began to embrace abortion. It's a natural fruit of it. So we really are going to counter this perceived need for abortion. We need to dig deeper and recognize that contraception itself undermines, the good of fertility as we should appreciate it. And so, does that help in sort of putting all that together?
Yeah, very well said. And the fact is that, the statistics do show us very clearly, even though so many on the pro-abortion side, and even some so-called pro-life people might want to say, oh, well, you don't like abortion? Then let's increase contraception. Let's fund it. Let's bolster it. Well, the fact is that does increase abortion. It doesn't reduce abortion in any way. Most abortions occur from women who are using contraceptives. And so, yes, it's very, very clear. It's a contraceptive mentality that we see on display in abortion. So that contraceptive mentality leads to more abortion, absolutely. But in hearing what you just said, many could say, okay, well, somebody from the left comes along, Nancy Pelosi can walk along and say, well, you just played right into my talking point. See, they want to take away our contraception. What is your response to that?
Well, I think that we need to not be afraid of that accusation. I think we need to be willing to challenge the presumptions underneath. I think we shouldn't shy away from challenging this idea that contraception is a good thing. And I think if we really are going to be spreading the gospel truth about man being created as a good thing, and that marriage is ordered for the first end of procreation, I don't think we should be afraid of challenging what has become accepted erroneously as a cultural norm. I will say that this perceived need of contraception, has become so pervasive. We become sort of addicted to it in terms of culturally our sexual, behaviors and recklessness, that people, I think it hardens our conscience, and it makes us hesitant to honestly consider the issue we talked earlier about. We want to rely on these things that we believe as contraceptives. We're not willing to consider whether or not they are abortifacients and how often they may be, on that one hand. And then as we become calloused and start having a disregard for these early human embryos, in that first week of life, then it has its effect on the other end with IVF. We've already been dismissing the intrinsic value of a class of human beings before implantation. So that's what IVF is all about. You have freezers full of these human beings before implantation. And so how did we get there? I don't think we ever get to a situation where IVF is culturally acceptable if we haven't already got accepted contraception, abortifacient contraceptive in particular, and then even other abortions.
Mm-hmm. Yeah, absolutely. And yeah, just to take it full circle where we started, that definition, that scientific definition of human life beginning at conception, fertilization, some will say, okay, I will grant you that a human being begins scientifically at conception, fertilization, but then they do this so-called philosophical twist and say, but every human person is not necessarily, or every human being is not necessarily a human person, where we would say, hold on now, what's the scientific difference between any human being and any human person? There is no scientific difference. It's only an ideological tool to try to dehumanize a certain class of human beings so they can devalue them and then do whatever they want with them. This is what we have seen with other human rights atrocities, like slavery and eugenics and all kinds of things over the centuries. So yeah, I guess I would just pose that to you. Any scientific difference between human beings and human persons in the womb?
Absolutely not. And I think when you start talking about personhood, you are inherently going to be speaking about a soul and the immortality of the soul. And we don't have to even go into these metaphysical, spiritual, religious arguments to assert the plain biological truth of when human life begins, because we don't believe that killing innocent human beings is wrong merely because, they're endowed with an immortal soul. We believe that killing innocent human beings is wrong because it's written in our hearts. God created us with this. This is natural law. This is eternal law. This is God's law, even though he's had to remind us of it in places like the Decalogue, the Ten Commandments, and throughout Scripture. But it starts in the heart where it was originally placed. And so I think it's ultimately a matter of intellectual honesty with ourselves and willing to accept the simple truth.
Mm-hmm. Yeah, great place to end it. The scientific fact of life beginning at human life beginning at conception, fertilization. Then the question becomes, are we okay with killing innocent human life, direct intentional killing of innocent human life, innocent human beings? Are we okay with that? The answer is no. Thank you so much, Dr. Damon Cudihy,